Ever get that feeling like you can't quite read the street signs, even with your glasses on?
Oh, yeah.
Well, imagine that, but it's everything, not just street signs. And that's what some people with keratoconus are dealing with.
And the thing is, there's so much we can do for it now, even just compared to 10 years ago.
Right. That's where we're doing this deep dive, to break it all down.
Yeah.
What's going on in your eye? What are the treatments? All of that. So, keratoconus. Kind of sounds like a dinosaur or something.
Right.
But really, it's all about your cornea.
The cornea, that clear front part of your eye, right?
Right.
Imagine it like a dome, like if you cut a basketball in half. Perfect shape.
Hmm.
But with keratoconus, it's like that dome. It thins out, it bulges, loses its shape.
So not smooth and round anymore, more like a bumpy road.
Exactly. And of course, that's going to affect how the light's getting in.
Makes sense. And a lot of the research we've been going through mentions that this often starts young, like between 10 and 25.
Yeah, you see it emerge then a lot, but honestly, it can happen anytime. That's the thing to really remember, any time in life.
So someone's listening right now, they're thinking, hold on, my vision's been weird. What should they be looking for? Red flags.
Well, obviously, blurry vision is a big one, but it's more than that. It's distortion, straight lines look wavy, halos around lights, especially at night. Things just look off.
Makes sense. And we know there's a whole bunch of things that can cause keratoconus, but you mentioned genetics and eye rubbing as big ones.
Yeah, those are definitely, we don't know everything about what causes it, but those two are definitely key.
So if keratoconus runs in your family, maybe try not to rub your eyes so much.
Exactly. Good advice. Don't poke the bear, you know?
Right. So as this thing progresses, are there like stages to it?
Yeah. You can think of it in stages, like climbing a ladder.
Oh.
Unfortunately, not a ladder you want to climb very high on.
Right. Okay, so the stages of keratoconus, what does that ladder look like? How do you even know where you stand?
So, like I said, think of it like a ladder, and at the very bottom, you've got the earliest stage. You might not even know anything's wrong at this point. Maybe a little extra squinting, but who doesn't squint sometimes?
Oh,
Right?
yeah.
It really takes a specific kind of eye exam to even catch it at that point.
So it's sneaky at the beginning.
Totally. But then we move up to that second rung, moderate stage.
Yeah.
That's where things get a little more obvious.
Yeah.
Your vision's blurry, maybe some distortion. You need a stronger prescription, like more and more often.
So
Love
less,
it.
is it just me? More like, okay, something's up.
Exactly. And this right here is why early detection is so important.
Okay.
You want to slow things down before you climb any higher on that ladder, you know?
Right, because I'm guessing those top rungs are not where you want to be.
No, not ideal. The third rung is the advanced stage. Cornea is thin, might be some scarring. Your vision at that point, it's really affected.
Wow.
Glasses or contacts, they might not cut it anymore.
And then the top rung, severe stage.
That's where things get serious. Like
Yeah.
it could really impact your vision, even in some cases lead to vision loss. And that can be very difficult to correct. But, you know, with early detection, most people don't even get to that point.
Okay, good. So we've talked about the signs, the stages, but the big question is, what do you do about it?
All right, so that's where it gets interesting. The good news is there's a lot we can do. And we're talking a whole spectrum of treatments, from simple stuff, non-invasive, all the way to, you know, surgical procedures.
Okay, lay it on me. Where do we start?
So in those early stages, we might be talking about something as simple as eyeglasses
Okay.
or regular contact lenses. But as it progresses, you might need something more, well, more oomph.
Okay. I like it. Like what?
Imagine a contact lens, but it's like a tiny custom-fitted shield for your cornea.
Okay.
That's basically what a scleral lens is.
A shield. Intense. Tell me more.
So it's bigger than a regular contact lens and is designed to vault over the cornea. It actually rests on the white part of your eye, the sclera. And what that does is it creates a little fluid-filled dome between the lens and the cornea. And that helps to smooth things out, gives you clearer vision.
So you're giving your cornea its own little swimming pool.
Yeah, kinda.
And this is good for, like, that moderate stage keratoconus.
Exactly. Scleral lenses have been huge for people. They can see clearly, comfortably, and it might mean they can put off surgery, maybe even avoid it completely.
That's amazing.
Yeah.
But what if you do need surgery? What are the options there?
Yeah, there are definitely times when surgery is the way to go. One option is a corneal transplant.
Okay, before we go there, break that down for me a little. Corneal transplant.
Sure.
Sounds like a big deal.
It is a more involved procedure, yeah. Basically, they're taking the damaged part of your cornea and replacing it with healthy cornea tissue from a donor. It's been a standard treatment for severe keratoconus. But like you said, it is a bigger deal than some of the other options.
Which brings us to corneal cross-linking.
Exactly.
Okay, now this sounds a lot less intense.
Yeah, this is where things get really exciting
Oh,
because now we're talking about a procedure that can actually strengthen your cornea,
okay.
slow down, even stop the keratoconus from getting worse.
Wait, slow it down, as in, like, stop it in its tracks.
Exactly. Hit the brakes.
Okay. Officially intrigued. How does this even work? So before the break, we were getting seriously sci-fi with this corneal cross-linking.
I know, right?
Strengthening the cornea. It's like giving your eye a superpower.
It really is pretty amazing.
But how does it actually work? Walk me through it.
So they use these eye drops,
Okay.
and the drops have riboflavin in them, vitamin B2.
Gotcha.
And then they use UV light, carefully calibrated, of course. And what it does is it creates these new bonds within the cornea.
So you're not just like adding something to it, you're changing the actual structure.
Yeah, it's like imagine you're weaving these tiny little threads through a piece of fabric
Okay.
to make it stronger, more resistant to stretching.
Yeah.
That's kind of what's happening with the cornea. And the success rate is incredible.
Yeah, you said like 95%?
Around 95%, yeah.
Mhm.
In terms of halting or slowing down keratoconus,
Wow.
it's been a game changer.
No kidding, that's amazing. But what about, are there cases where maybe someone's not a good candidate for cross-linking? Or maybe it's more advanced? What are the other options?
You're right, it's not for everyone. There are a couple other procedures that might be a better fit depending on the situation. One of them is called topography-guided conductive keroplasty,
Okay.
CK for short.
I'll be honest, that one sounds a little
A
intimidating.
mouthful, yeah.
Topography guided, what does that even mean?
So basically, they use this really precise mapping system
Okay.
to create like a 3D model of your eye's surface.
Okay.
And then they use that map, like GPS, for your cornea,
I like it.
and they apply these controlled pulses of radio frequency energy to reshape the cornea.
It's like using a tiny little sculpting tool to smooth everything out.
Exactly. It's quick, it's non-invasive, and it can make a big difference.
Okay.
Might not be a permanent fix, though,
Got it.
but especially in those earlier stages, it can be really effective.
Okay, that makes sense. So we've covered the, I guess, less invasive stuff, but we got to talk about corneal transplants, right?
Yeah, we do. Penetrating keratoplasty,
Mm-hmm.
PK. That's still the gold standard when it comes to treating those really severe cases, the ones where the other procedures just aren't going to cut it.
And just remind us, what does that involve? A corneal transplant.
So basically, they replace the central part of your cornea, the damaged part, with a healthy cornea from a donor. It's a very delicate surgery, obviously,
Yeah.
but it's been incredibly successful, especially for people with advanced keratoconus.
It's amazing what they can do these days.
It is.
It's literally like getting a whole new window to see through.
Yeah.
Speaking of new windows, we also came across something called DALK. How's that different from a regular corneal transplant?
Oh, good question. DALK stands for Deep Anterior Lamellar Keratoplasty. Think of it like a more selective kind of transplant. So instead of replacing the whole cornea, they only do the front layers.
Okay.
And they leave that innermost layer, the endothelium, they leave that intact.
So a partial upgrade.
Exactly. And because you're not replacing the whole cornea, the recovery time is usually faster.
Oh, wow.
Lower risk of rejection, too. It's a really cool advancement.
It's incredible. It seems like there really is hope for everyone, no matter, where you fall on that progression ladder we talked about.
There really is. And I think the biggest takeaway here is early detection is everything. If you notice something's off with your vision, go see an eye doctor. Don't wait.
Because the earlier you catch it, the more options you have.
Exactly.
Knowledge is power. All right, everybody, that was a deep dive into keratoconus, from the basics to the cutting edge. Remember, you're not alone, and with the right information and care, you can absolutely live a full and vibrant life, even with this condition. Thanks for joining us, and we'll see you next time for another fascinating deep dive.